Hi everyone, my name is Jenna Boyer and I am currently taking the Breastfeeding Experience Theory course through BCIT. This video presentation is focusing on the breastfeeding challenge of a blocked mammary duct with an infant who has a tongue tie. I will be using the situated clinical decision-making framework to discuss this particular challenge. The framework focuses on 5 key areas. These include knowledge, cues, judgment, decision, and evaluation. So first of all, we'll focus on knowledge. A blocked mammary duct is simply a duct that has become blocked with milk. The main reason this occurs is because milk is not effectively being removed from the breast. Tissue surrounding the duct can become inflamed and painful. However, this inflammation and pain is often decreased by removing the milk from that area of the breast. Next, a tongue tie. A tongue tie is when the lower frenulum, which connects the tongue to the lower part of the mouth, is either too short or too tight, impeding the infant's ability to manipulate their tongue properly. Tongue ties are hereditary, and approximately 0.2 to 2% of infants are born with this. Nonetheless, every tie is different and every breast is different, so some babies may be able to latch and feed quite well immediately. A blocked duct with a tongue tie occurs because the infant cannot effectively remove the milk from the breast. Of course, every situation is different, but the majority do have difficulty getting the proper latch. Breast tissue may also get pinched between the baby's gum, causing discomfort and pain for the mother. Next, we'll focus on cues. Signs and symptoms of a blocked duct include localized pain, redness, a small hard lump in the breast, and some women can even experience palpable temperature changes of the breast. Blocked ducts, if left untreated, can become infected, which is also known as mastitis. If mastitis occurs, the woman will need antibiotics, and in severe cases, even draining of the abscess. In regards to a tongue tie, a physical assessment is a good way to determine its presence. Most ties are quite visible and can be seen when the baby is yawning or crying. If unable to see the frenulum, you may put on a clean glove and insert your finger into the baby's mouth to see how their tongue moves around your finger when trying to suck. If a tongue tie is present, an assessment by a doctor will follow. Falling off the breast or a clicking noise when breastfeeding are also signs that the baby has a tongue tie and is not latched for effective milk transfer. Other information that can be collected to determine the significance of a tongue tie is weight gain trends. If a baby is having poor weight gain, then the logical assumption would be that the tie is severely impacting their ability to remove the milk, and further investigation will be required. Moving on to judgment. If a mother develops a blocked duct, she can do some at-home remedies, such as massaging the breast, hot and cold compresses, and frequent feedings in the direction of the blockage. This may be uncomfortable, but is the chosen mode of treatment for many mothers. She may also use a manual or electric pump if the baby is sleeping or full. If these fail to remove the blockage, she can make an appointment with the doctor for further assessment and treatment. Consultation with a doctor, midwife, or lactation consultant is encouraged before taking any medications, herbal or over-the-counter, to treat blocked mammary ducts. In regards to a tongue tie, a family doctor or pediatrician can assess the infant and discuss with the mother if the tie is causing difficulties with breastfeeding. If so, a frenectomy may be performed. It is a quick procedure requiring no anesthesia, minimal discomfort, and practically no recovery time. This will free up the tongue to move appropriately. The downside to a frenectomy is that it may be challenging to find a doctor who's willing to perform this procedure, as frenectomies have become a controversial topic in the medical community. This is because of debates around nerve damage, infection, and the chances of self-resolution of the tongue tie as the baby ages. My priorities for this challenge would be to educate the parents on signs of an effective latch, audible swallowing, flanged lip, and full cheeks, and how it may take longer to find the position that makes latching easiest for the infant. Next, about signs and symptoms of blocked ducts, localized pain, tenderness, and even temperature changes, and how, if left untreated, can become mastitis, requiring medical intervention. Next will be decisions. As previously mentioned, treatment for blocked ducts include home remedies such as massage, hot and cold compresses, and frequent breastfeeding with supplementary pumping if needed. Anti-inflammatories are okay if your doctor, midwife, or lactation consultant okays them. Further medical treatment may be required if the blocked duct fails to resolve. As for the tongue tie, treatment is often education-based, including what an effective latch looks like and sounds like, different nursing positions, and weight gain trends. Treatment can also be a frenectomy, but this procedure is often not performed and is to the discretion of the doctor. Nursing support is critical for breastfeeding challenge because it is a highly emotional and stressful time in the new mom's and parents' lives. And adding a complication, such as a tongue tie, that leads to a blocked mammary duct can be too much for them to handle. Unsuccessful breastfeeding attempts don't often bring out the best in people, and in a case such as this, adding pain and frustration makes for a confidence kill. Spending time practicing latching and different ways to hold their babies will help bring that confidence back. Incorporating a lactation consultant may bring new insight to the issue and help the mom and parents with unanswered questions they may have about their infant. Finally, the evaluation piece. How do I know if my efforts have made a difference? Does the mother have any unanswered questions? Does the father or other family members? Can she explain what a good latch looks and sounds like, and does she know different ways to hold her baby to nurse? Is she aware of home remedies to relieve blocked ducts and when to seek further medical assistance? Is there any follow-up or consultations needed? And finally, is there steady weight gain with the baby? In conclusion, blocked mammary ducts that occur in the presence of a tongue tie can be treated without medical interventions. At-home remedies prove to be effective if done in a timely manner. Although some babies will have difficulty feeding, a tongue tie does not mean that they will never breastfeed. Patience will be needed as well as the continued desire to breastfeed. If medically necessary, a frenectomy can be performed by a doctor, however, controversy surrounds this procedure. Nursing support and continued education is imperative regarding this challenge that may present themselves in the event of a blocked duct. That is my presentation on a blocked mammary duct with a tongue tie. I hope you enjoyed it. Thanks for listening.